Welcome to the Alternative Dog Moms Podcast. I'm Kimberly Gauthier, creator of Keep the Tail Wagging. I've been blogging about raw feeding, pet wellness, and life as a crazy dog mom for more than 10 years. I've seen massive improvements in my dog's health since I began raising my dogs naturally, and I'm passionate about sharing my experience to help other pet parents.
I'm Erin Scott from the Believe in Dog podcast. For more than 10 years, I've been researching and learning everything I can about healing cancer, allergies, autoimmune, and mystery illnesses in both my dogs and myself. And I can't wait to share with you everything I've learned in case it could help you too. As the Alternative Dog Moms, Kimberly and I are bringing you all the latest dog health news that we're following and the brilliant people we're meeting along the way. Now let's get started. Hello, Kimberly.
Hello, Erin.
So I'm excited. We have an awesome guest with us today. I got to see her speak a couple years ago, and I've been wanting to reach out to her. Finally pulled the trigger. We have one of the pioneers from the field of canine rehab with us today, Dr. Deb Torraca. Welcome.
Thank you. I'm excited to be here. Thank you so much.
I have so much I want to ask you and all these things to dive into. But we love starting off with an origin story. And so I believe you started working in like the human physical therapy field and then we're like, oh, animals probably need this too. Or how did that all come about?
Yeah, so I started in the human field and I was like, wait a second, we're doing all this stuff on people. I'm like, that's cool. But while I'm practicing stuff and my roommates got tired of being guinea pigs and I turned to my family pet. And I remember asking one of my professors, I was like, why don't we do these things on dogs? And I remember her plainly saying, Deb, it's a dog. Like no one cares that much about animals. Like we're never going to get to that point. And I remember fast forwarding probably 15 or 20 years and I was speaking at a conference and I bumped into her. I'm like, remember that kooky idea I had about all of this? So while I was going through human physical therapy stuff, I always kept it in the back of my mind and started thinking about it. And I focused on human physical therapy or human sports medicine, I should say. And there was a lot of overlap. And I worked in an office where they did a lot of pediatric stuff as well. So I was constantly watching, wow, there are a lot of similarities. And while I was getting my master's degree, I worked with a professor and I told him my idea. He's like, that's great. He's like, you're absolutely right. Everything is so similar, with joint disease, with obesity, with so many of the musculoskeletal diseases and all of that. So he really pushed me to, for lack of a better term, start being a pain in the ass to learn more and to get in surgical centers and learn from different veterinarians, learn about the neurological systems and way back then, I hate to age myself, it was I was a pest because a lot of veterinarians were like, what? What are you talking about? And I remember they were tossing me the most difficult of difficult cases, just to shut me up. And slowly, things started to evolve. And I'm like, hey, I got this dog better and this cat better. And look, if, we fed these dogs a better food and, what would happen? And if we looked at preventative medicine and it just kind of rolled from there. And now I was thinking about the other day, I've been doing this almost 30 years now, and just how much has evolved from, not only are we looking at, surgical rehab, but we are looking at prevention, so we're looking at those overweight French bulldogs and trying to inform owners listen, you need to do something now, so we're actually being proactive, which is incredible, to get in there. And it's wonderful that we're, seeing such a variety. It's not just the, awful cases. They're in a lot of terms, very minor, cases, or we're seeing them for conditioning and a lot of the working dogs that are coming in, we're just keeping them fine-tuned. So it's not doesn't become a decision-making process for career ending or life ending or anything like that. So it's been just such an incredible evolution and so much fun when I think about it. And I always joke that I'm like, every day I learn something new, or like a new breed pops up or something different. I'm like, oh, I never knew that. So it's very fun.
I love that. I'm watching my parents get a little older,
Mhm.
watching my senior dog, and it's
Yeah.
really solidified with me that, like, mobility is our quality of life.
Yep.
And, I'm working with my old man who has had some, like, muscle wasting kind of
Mhm.
things with
Mhm.
doing different exercises, and I don't know if my vet told me this or where I absorbed this, but you had touched on obesity, some,
Mhm.
and so I remember somewhere I picked up that, like, the 2 greatest things that pet parents can do for their pet's mobility is nail length and keeping their weight down.
Yes. Absolutely. Yeah, nails, that's something that I just become, like, laser focused when a new dog comes in on their nails, and, try to make a difference with that, but definitely the weight. I mean, I would honestly say I have a very busy practice, and if 75% of owners would take weight off their dogs, I would lose 75% of the clients. Like, that is how big of an impact weight takes on their body. And, many of us don't realize that if you have a dog that should weigh 10 pounds and they weigh 12 pounds, that's a significant amount of weight, extra weight on them. And just losing that little bit of weight and getting their body condition feeling better makes such a huge difference. And getting that muscle mass and, really mobility is the key to life. I often, when I'm teaching veterinarians and physical therapists, and technicians, I'll let them know that you can often save a dog's life if you can get them up and moving to go out to eliminate, because like that simple step, if you can keep them moving with that, that's going to help them, literally, keep them alive.
Yeah, that's a big part of the quality of life, yeah.
Yeah. Yeah.
Yeah, I have a senior dog. She's gonna be 13 in October.
Mhm.
And we I live on 5 acres, so for
Uh-huh.
her, we border our property borders a trail, a walking trail,
Mhm.
but she's just not a fan of walking on the trail. No, quite blame her. So we do a lap around the property.
Awesome.
And there is a time when she could only do maybe 1 lap. There was a time when she couldn't even do a full lap, but I learned from another raw feeder and dog trainer, Ronnie Lejeune of, Perfectly Rawsome, to instead of rushing your dog to keep up with you, walk at their pace and then
Yes.
just add a little. And it
Yeah.
didn't take long, and it's just and then, of course, other things that I'm doing with her, she enjoys going
Yeah.
out and going and doing all that walk, and so it's just one of those where it doesn't seem like a whole lot because I
Yeah.
think sometimes we tell ourselves, especially if I have a friend who takes her dog hiking every weekend, so
Mhm.
they're going for miles all
Right.
the time,
Right.
and it's just like, I think I did count how many laps around our property can be a mile, and I think it is if we stick to the borders of our property,
Mhm.
2 times around is almost a mile.
Yeah.
But, I'm happy that she's
Yeah.
at her age that she's still excited to go out and do that lap.
Absolutely. And that's such an incredible enrichment activity. And
Mhm.
absolutely, I tell owners all of the time, because I joke that often dogs that live in the city are in better condition than dogs that live in the country because they have to go out and walk.
Mhm.
But, anything is so good mentally and physically, as enrichment. So that's so, so good,
Yeah.
Kimberly.
Yeah, it's one of those where it's so easy to fall into I'm just gonna put them in the yard,
Yep.
but
Let them.
I know that my dogs will just sit. They
Yeah.
just sit in the yard.
Yeah.
When they're puppies, they play,
Yeah.
but as they get older, they just sort of they sniff
Yeah.
around, they use
Yeah.
the yard is where they go and use the bathroom. That's not really where they do
Yeah.
anything, and even if I let them out onto the property, because sometimes they're all at a place where I can trust them not to leave the property. So I can let them out for a few seconds while I grab a whistle and things like that. They'll run a little bit, but after a while, they'll just lay down and wait for me. It's not
Yeah.
until I'm out there and
Yeah.
facilitating, okay, this is what we're going to do, that they're
Yeah.
actually getting exercise. And she's the only one that she and 2 of my dogs will walk around the property. The other 2, I have to take them
Yeah.
for walks because otherwise they wouldn't get any exercise at all. And I think for a lot of people, especially because, we work full time
Mhm.
and then, we have, our human lives.
Yeah.
It's so easy to allow the dog chores to fall by the wayside.
Absolutely. Absolutely. I always ask owners, what do you do for activity? And when they say, oh, I let them out in the backyard, I'm like, okay, that's great, but that doesn't count as activity. So,
Mhm.
let's get another activity in there, whether it's you wake up 10 minutes earlier in your day and just get a 10-minute walk in or anything like that. But that's great.
Yeah.
And I'm
And it's so good
sure
for
you're,
us too.
yes, absolutely. It's so good for us to get out and move. Absolutely. Yeah.
And so, what is most of your practice more on the preventive side? Is it post surgery? Is it conservative management instead of surgery? Like, what kind of do you see every day?
We see a little bit of everything. It was really interesting during COVID, our conservative cranial cruciate cases were super high because so many clients couldn't get into surgeons. There was a 3 to 6 month waiting list. And it was very interesting to watch because it was almost our own control study. So they had no choice but just to do conservative rehab. And the surgeons sort of hated us because about 70% never went to surgery. So
Oh,
they were able to lead, they got their weight off. We were able to control their activity, reduce their inflammation, built up their strength, and they hit their quality of life markers. They did fantastic. So we've been using that as kind of our little, this is what we did. And the rules were they couldn't play ball at home. They couldn't let them jump off of a bed or a sofa 1,000 times, at once. So but we still see our surgical cases. We see a little bit of everything. Definitely soft tissue injuries are more on the rise, but I think the veterinarian teams are getting much better at diagnosing them. So we're seeing more and more of them as well.
So Kimberly knows it is a hill that I will die on,
Mhm.
that with CCL tears,
Yeah.
I don't think they need surgery anywhere near as much
Mm.
as surgery is recommended.
Mhm.
And, I always look at it like, when you're a hammer, everything looks like a
Yep.
nail. So if you go to a
Yep.
surgeon, they're gonna say you need surgery.
yeah.
Yes. And my philosophy, and I'm very honest with owners, I'm like, listen, you can always cut, you can't uncut.
Mhm.
So I like to take things incrementally, like let's move ahead, try this conservative approach. We'll move ahead 2 weeks and reassess and then keep moving. The only big rule of thumb is if they're painful, and if they have a meniscal tear, because that's going to really they're not gonna progress at all. So, but yeah, I mean, in my opinion, I think if we took all the dogs in the United States, in the US particularly because of and that's like another thing that topic for another day, our spay neuter rates, the obesity rates, all that sort of stuff. I'd probably say that 50 to 65% of the dogs have cruciate tears to some degree. I mean, because it's not like humans that it's just torn and that's it because they're percentages. So, you can open up the dogs and say, oh, they have a 5% tear. This warrants surgery. No, so
And conservative management doesn't mean, like, not doing anything, right?
no, not at all. So I always say crate rest is not rehab.
Right.
So that's like, in the human world, like how often have you heard like, oh, you hurt your back? Kimberly, you need to be on bed rest for 4 weeks and not do anything. Like you're moving, you're doing stuff. The same with, if we get injured, it's controlled, so like I said, it's not ball playing. And it's something I say to owners right away. Like you have to commit, you cannot play ball with your dog. You cannot toss something because that um, action that's stopping to get the ball
Mhm.
is what stresses the cranial cruciate ligament. So that motion has to stop. And just that conversation with owners, it's amazing. Like I feel like I need a therapist on staff to talk to the owner more. Like the dog will never forgive me for not playing ball with him. I'm like, okay, this is, beyond my pay grade here. Like you cannot do this. Like there are other activities, there are many other things that, we could do. But they have to commit to that. But they're doing lots of balance and proprioceptive activities. They're walking at home. In the clinic, we're doing plenty of dynamic activities. They're walking in the underwater treadmill. We're either treating them with laser therapy and/or shockwave. They may do laser therapy at home. They're doing a lot of core work. So it's it there's a lot of things that they're doing. So it's a pretty, I don't want to say like, of course the dog rests, but it's not like an 8-hour exercise
Mhm.
program per day. But it's definitely, a lot of dogs turn out in better shape post injury than they were, pre-injury. So, getting their muscle tone up, changing so often their diet. Dogs are so muscular or should be so muscular to begin with, and just getting that, that muscle tone, on them. So, but yeah, I always say if someone says, oh, put the dog in a crate for 8 weeks and then let him out and just see what happens. No, run for the hills. That's not the answer.
Yeah.
So, yeah.
With my dogs, I have a dog that's ball obsessive, and
Mhm.
we have a huge basket filled with balls, and she'll
Mhm.
just go want to walk around with the balls in her mouth.
Yep.
And here in the Pacific Northwest, it's like if it's raining, we don't
Yeah.
play with the ball
Yeah, yeah.
because of this. I just worry about her slipping and what that can do. But when we go and do our laps around the property,
Yep.
I'll just give her a ball
Yeah.
that she can carry,
Yeah.
and she's perfectly happy with
Yep.
that, where she'll drop it and stuff, but it's like, as long
Yeah.
as she can have the ball,
Yeah.
and we have a perfectly good time,
Yeah.
and it's not that that's the solution, I just started training her that way,
Mhm.
so that she understood that just because you have a ball doesn't mean I'm going to throw a ball,
Yeah.
and, so she has no idea because 'cause she'll get ready like, "Oh, there's a ball," and I'll just give it to her, and she'll, like,
Mhm.
quickly realize, "Oh, okay, we're not doing that today." And
Yeah.
so we'll just walk around and she'll just have her ball with her.
Yeah. And there are a lot of and people will say, "Oh, I don't have time to walk my dog, so we play ball in the backyard for 5 minutes while I drink my coffee." And I'm like, "No, no, no." Like, they're not warmed up. They're not,
Mhm.
there's so many things that I wanna pull my hair out, and I'm like, "No," and then I didn't mention the dog's probably overweight because that's
Mhm.
one of the, high risk factors as well. So,
Yeah.
yeah.
Yeah, I think it was my old girl Kahlua, and this is going back to, like, 2011 time now, but that was, like, my moment that that turned me into an alternative dog mom, where I was like,
Yeah,
she was a dog that did not do well on crate rest. She
yeah,
would, like, fight to get out of a
yeah,
crate if you put
yeah,
her in there, and I'm like, "I can't put this dog
yeah,
in surgery and then put her in this crate and
yeah,
keep her away from my other dog," who she was like they were just, like, obsessed with each other, and that was when it was like, "Okay, so what else can I do?"
yeah.
And looking around to see alternatives, and she was actually part of the clinical study that Dr. Knapp's office
Mhm,
did on using knee braces
mhm.
for CCL tears, so we were actually part of that.
Awesome, awesome. Yeah.
That was my defining moment, Kimberly, in becoming an alternative dog mom.
Yeah. There and you know what, there and I heard, I mean, fortunately, it's becoming less frequent. But I did hear it a few weeks ago where a client went to their veterinarian and said, you have to do surgery on your dog or euthanize for a cruciate tear. And I was like, that is so far, eh, from the truth. Like
Mhm.
I was so upset and angry. And so, no, there's so many alternatives out there. And, especially with the cost of cruciate surgery, and there's so many different options. And just from, along the East Coast, I mean, the prices can vary thousands of dollars. So it's, and it's not a do or die situation either, so
Yeah.
it's nuts.
Aside from my own cynical opinions that it's, monetarily, influenced, how did the surgery become kind of like this automatic go-to recommendation? Has it always been that way?
Yeah, so there was a study done. So we know that once the cruciate or the cranial cruciate becomes damaged, the stifle or the knee starts to become arthritic. So the longer that this instability occurs, the more arthritic the stifle becomes. So by stabilizing the stifle, whichever way, whatever surgical procedure, there'll be a reduction in the arthritis. But there was a study done where they took healthy dogs with fully intact cruciate ligaments. So they opened up the knees, they cut the cruciate ligament, they repaired it. And so within it was only torn for a few minutes. And all those dogs led to a higher incidence of osteoarthritis. So no matter what, you're still looking at a higher incidence. I mean, definitely you're looking at comfort. I mean, a lot of dogs, and what happens is the level of arthritis can build up that it protects the knee, it medial buttresses, so it stabilizes. Um, of course, if the knee becomes too painful or it's impacting the quality of life and making the animal miserable, then, or if there's other conditions. So, we're treating a dog right now that has bilateral cruciate ligaments and elbow dysplasia, and it's really just struggling to put weight on any joint. Like I joke, 4 flat tires. So in that case, surgery is going to be the best option because she can't put her weight onto the front legs. So, but it, the numbers in the US are much different than in Europe with our cruciate. And again, is it spay neuter? Is it quality of food? Is it weight? I don't know. There are a lot of differing opinions. I mean, there's not as many fat dogs in Europe as there are in the United States. But again, another topic, another day.
Yeah.
That might be one we have to dive into, Kimberly.
Yes, it's
I
always
know.
interesting. When I go over there, I'm like, I don't see fat dogs. I don't see, like they speak at the London Vet Show every year. I'm like, you guys don't have any bracing companies over here. And they're like, we don't need it. We don't see the
Mhm.
level of cruciate injuries that you guys do. I'm like,
Wow.
Yeah.
interesting.
I spoke with a dog owner years ago who was talking about, I don't remember where she lived, but where she lived, their dogs could go out and about all the
Mhm,
time,
mhm,
and they didn't do spay and neuter, and
mhm.
they didn't have a homeless dog population,
Yeah,
and they
yeah,
were like, "These people were responsible about their dogs."
right, right.
And it's just, and I think that that comes with a lot of things in our country where veterinarians take things to the extreme. I mean, they
Mhm,
do it with diet, with
mhm,
surgery, with everything because they don't trust their clients to do the work
right,
that needs to be done.
right,
And and that's the hard part, is that it's gotten to a point where they don't even give us the option.
right.
Because I've spoken to so many veterinarians who, for instance, are passionately anti-raw feeding, but
Mhm,
when I explain to them what I do,
mhm.
everything changes. Like, all of a sudden, they're
Yeah,
asking me questions, and we're actually having a really great conversation
yeah,
about canine
absolutely.
nutrition, and they will admit, "I don't trust any of my clients to do what you're doing," and I feel like I'm doing it's nothing. It's just, I've been doing it for so long that it's just what I do.
No, I agree. I completely agree, and it's the same, like vaccinations, all of that sort of stuff, and I even remember when my daughters were infants that I wanted to space their vaccinations out, and the pediatrician said, "I don't trust you to bring your infant back in again in 2 weeks." And I was like, "Are you out of your mind?" So then, the same thing with puppies, like,
Mhm.
"What?" "What?" Like, this is yeah,
Yeah,
but you're
I mean,
right, you know?
it's interesting because it takes time, and you also have to have a veterinarian that's going to take the time. I take my dogs to a traditional vet, and
Yeah,
we have a conversation about vaccines, and
yeah,
I explained to them that I was gonna do the puppy, I was gonna do the one-year booster, and then after that, it's like I felt comfortable with waiting 4 to 5 years,
yeah,
and I did not feel comfortable vaccinating after 7 years,
yeah,
and they weren't happy with it, but they were like, "You know what?"
yeah,
They see my dogs when
yeah,
they see them, and my
right,
dogs are fine, they're healthy, and I do listen to them on other things. So
yeah,
it's not like I'm shutting everything down,
yeah,
and if they ask me for why I wanna do things, I'll come with receipts to
yeah,
explain that, "Hey, I read this study," or, "I'm following this
yeah,
veterinarian who found this information out," and we can have a conversation. But unfortunately, not everyone has that
right,
luxury of having a veterinarian that's willing to, have that type of conversation with them.
right, I know.
Do you notice, like, with, is there a certain type of action that constantly leads to certain injuries? So, for instance, playing fetch,
Mhm,
or that, you're seeing a correlation between people doing this too much is
yeah.
causing these injuries.
Yeah, I think definitely the downward stopping motions. So the playing fetch, and that eccentric, so that slowing down motion, like going after a ball, not only puts stress on the knee, but also that iliopsoas muscle, the hip flexor, also the biceps tendon. Um, that that motion, also for our Frenchies, our dachshunds, the jumping off the couch, off the bed repetitively, that's the motion that's going to get us in trouble. Um, so be proactive, think about it, have, my I have a little Brussels Griffon. He's already hurt his back. We have a step so he can get off the bed that way, so just thinking about how we can break down the motions. And those are really the two big, you know, things that, try to control. And, within reason, I always try to tell owners, try to control it 50% of the time. I mean, we
Mhm,
can't, they're dogs, they're going to do stupid stuff, so, but if you can control that 50% of the time, that'll make a big difference.
mhm. I have
Yeah.
it's called a puller ring. It's the
Hmm.
purple ring,
Yep.
and I've found that that seems to be a little more gentle
Yep.
because they're not doing the stopping, they're
Yep.
running alongside of it to pick it up,
Yep. Yep.
and
And
then slowing down and turning
yeah,
around rather than with the
absolutely.
ball. And I've started with the balls, I actually throw them up
Mhm,
so that they'll run and they slow down and stop and wait for it to come
mhm.
down, and then they get it rather than
Yeah,
throwing it at a level where they're gonna. I've
yeah,
had a partial cruciate tear, so
okay.
I try to
Y
figure out all these different
I
ways to
know,
play with
I
my
know.
dogs.
It's that abrupt stop that,
Mhm.
jamming on the brakes, and there's a lot of force there that
Yeah,
can
and I
stress
think that
them.
what you said earlier about the warm up, I mean, as
Yeah,
humans, we know that if we're gonna go and work out, we're gonna do some stretching and we're gonna have a warm up session, but we don't actually think about doing that with our dogs. We just go out and
yeah,
hit it.
and they're so excited that they're like, "Woo-hoo," we don't need a
Mhm.
warm up, we're just gonna jump right into this and, all of that, so, yeah, no.
So my old man has had the bicep tendonitis
Mhm.
from jumping off the bed, I imagine. And we've done shockwave for
Yep.
that, a couple rounds of that, and it helped a lot.
Yeah.
And we work with this animal communicator, and we have steps up to our bed. And we said, why won't you use the steps up to the bed? Why do you have to jump down? And he was just like, I don't like the steps. Like, they make me nervous, because he's kind of a anxious guy,
Yeah.
and for a 70-pound pit bull. And so, we were like, well, you keep hurting yourself jumping off the bed. And he's like, oh, well, you guys can just lift me up then. And I can't even pick him up
Oh gosh. Yeah.
myself, and
I
so
could not imagine.
and so, yeah, every night, it's like he stands there and, like, waits for my husband, like, "Come and
Yeah.
lift me up now."
I know, it's
So
so funny because I lowered my bed,
yeah.
for Sydney when Sydney was older, and when she was diagnosed with hemangiosarcoma, and
Mhm.
that was one of the things is I was told she can't be jumping up and down off
Yeah,
things
yeah.
anymore, and so I lowered my bed to the floor for her. And now it's back up again, but I went and got steps. I was
Yeah.
so happy, and I even did a video training
Yeah,
Zoe
yeah,
how to
yeah.
use the steps. Do you know she's never used this after that video, she never used the steps again. I mean, they're up here now, and I was so happy because I researched and I was
Yeah.
thinking maybe if they were a little wider,
Yeah, wide
you
at the
know
yep.
and deeper, she'll be more interested. She is not, and she has finally accepted that she will not jump on my bed anymore. But we took our sectional and we took the feet off of it, so she can jump on the
Onto
sectional,
that.
and so
Huh.
she's happy with. But it was just like, God, the changes we make and the things that we do for these
I
dogs.
know. Erin, I have a 72-pound Clumber Spaniel who's just dense, and he had the same thing with his biceps, and this like, I'm like, "Okay, I don't want you to" like, he would jump up, but then I'm like, "Okay, down," and I would pick him up, and he would just we call it, like, growler, like, talk, and I'm like, "Well,
Rumble,
you
yeah.
idiot," like, "I have to get you down, and this is what's gonna happen, and until it gets better," and now they have a dog bed that they never use, and it's there as their step, so it's kinda
Mhm.
like his trampoline to get down. I'm like, "Okay,
I love it
rearrange my bedroom for you." I'm like,
Yes, exactly.
all the time.
yeah,
I swear I that's what I want to do is I want to invent steps. I
I
know
know.
they've already there, but it's the steps that are on the market are all for little dogs.
Yes,
But the steps for big dogs, they need to be deeper, they need to be wider,
Wider.
more
um,
sturdy, the same
yeah,
for cars, and,
yeah.
like, I look, I'm like, "Your Leon Burger is not gonna get on those steps, I will guarantee you," you know?
Or that little narrow ramp.
Ramp. Yeah,
Yeah.
we bought the ramp, and, yeah,
Uh-uh.
he wouldn't use that either.
Mm-mm.
Yeah. We tried all the things. So back when my old gal was my double CCL girl,
Mhm.
I was very much a newbie pet parent, and I look back now and I'm like, I wonder how many signs I missed,
Mm.
that,
Mm,
she was in pain or something wasn't
Yeah.
right until the limp where you're like, "Oh, this isn't good." So,
Yeah, yeah,
what are some signs of pain that we should look for in our dogs, or just,
yeah.
like, discomfort that maybe something's not right?
Yeah. So it's really so dogs put 60 to 70% of their weight on their front limbs, 30 to 40 on their rear. So it's easier to hide problems in their hind limbs,
mhm.
because they can just transfer more weight onto their front limbs. So I always say, like, just look at your dog. If you think that they're bulking up front, that they look like they're getting really bulky up front and skinny in the rear, chances are they're, really imbalancing themselves. And then look at their elbows. So I always say elbows should be like tail lights in a car and point straight back. And if they're pointing to the side, they're also putting a lot of weight onto the front. Um, the other thing is when they get up or sit down, do they make grunts? So do they, "Oof," or, kind of strain to get up? Do they make those type of noises? when they walk, if you look at their back or their top line, does it stay level or are they kind of hunched? Um, do they kind of shuffle? And listen, especially on hardwood floors, do they tend to maybe scrape their nails a little bit? And if in doubt, and owners usually love this, take some bright nail polish and paint the top and bottom of the dog's nails and go on a walk and then maybe look at the nails like 24 or 48 hours later and just see if they've worn out evenly on the bottom and hopefully kept the top part normal. Because if they've scraped a little bit, they may be dragging or anything like that. But I will always say reluctance to do things. So, something good to do as a pet parent is every 3 months, write down what your dog is doing. So, we're on the Erin and I are on the East Coast. It's summertime, it's hot. So, the dogs are lazier than normal, but what is their normal routine? So they, walk, like Kimberly said, her 13-year-old does the loops. So just like their normal activity. And then every 3 months, revisit that. Like, and keep track of their weight. Has their weight gone up, gone down? Um, like little things. You can take pictures and just kind of keep track of things, anything significant, anything different, with, what's going on. Because it is. I mean, they do such a good job hiding stuff from us. People think, I've had so many owners come in and their dog is on 3 legs and they're like, well, they're not crying, so they're not in pain. Well, yeah,
Mhm.
they are in pain because they're not using their leg, so they're just, animals typically don't verbalize like people do. So, they're very good at hiding things and, we have to really be perceptive. And of course, I do it with my own dogs. Like, I don't want to see things sometimes. I'm like, oh, that wasn't
Mhm.
a limp. That, nah, nah, and it takes someone else to say, oh, my husband will say, I think, Essex is limping. I'm like, nah. I'm like, what do you know? You know? I'm like, I do this all day long. I would know. But, sometimes we may not want to see that or anything like that. But, subtle signs. And of course, if they're reluctant, so if your dog jumps up on the bed and all of a sudden it's like, ah, I don't want to do that. That's something to pay attention to, or the car, or, doesn't want to walk on a slippery surface or the grass or, anything, different out of their norm to try to figure out why.
Yeah, I'm the one that's like, "Oh my god, are they limping?" And my husband's
I
like,
know.
"It's fine.
Yeah.
You're imagining things." Yeah.
Yeah. And, again, and they do stupid things sometimes like us. I mean, we may overdo it and, like give it a day unless it's really bad or,
Yeah. Yeah, I usually know when it's funny because it takes some time to trust yourself
yeah.
because I feel like we've been trained not to trust ourselves, to
Yes.
just trust the vet. But after a while, when you sort of take on that role of being a true advocate, you start noticing and you start tracking. I mean, I know for some people it helps to just keep a journal of what's
Yeah,
going on.
definitely.
If I notice a certain behavior, I'll start marking it on a calendar just
Yeah.
so that if I do need to take it to a vet, I can sit down and go over. I
Yeah.
years ago I had a dog that had a fever and the vet wanted me to we couldn't figure it out, so she wanted, me to track his fevers over a few days, and she was like, "Take the fever at these times." And so I had a whole spreadsheet where I brought everything down, and I thought, I mean, it's what she told me to do, and I'm an accountant, so that's what I
Yeah,
did.
yeah, yeah,
And I
yeah.
show up with this spreadsheet, and she actually kept it, and she went to other people like, "This is what I need you to do."
This is the
I said,
compliant
"You
owner.
really took this seriously?" And it's like, "Oh, yeah," and just so we could figure out what was going on with
Yeah,
them.
yeah,
But it's like, I mean, it doesn't have to be that,
Or
yeah,
video, like, because sometimes I
yeah,
feel like the limp might be, like, intermittent
yep,
or something,
mhm,
and so I try to
yeah,
remember to take video because it's like they won't do it when you go to the vet or something.
no.
Yeah, yeah.
Oh, and that like, I will always say to owners too, like, I give them my WhatsApp number. I'm like, "If your dog," 'cause of course, they're not gonna limp when they come in for an assessment. I'm like, "Video it and
Mhm.
save it or send it to me, or not at 2 a.m., but, whatever. And so I could see it, what you're talking about, or something like that. But definitely.
Yeah. But Zoe, we have our porch, and we have the steps up to the door, but to the left or right, I can't remember. Um, it's basically from the ground, and it's about a foot jump onto the porch. And she will go to that part every single time. And part of me is happy because it's like at almost 13, she still wants to jump on
Yeah.
the porch.
Yeah.
But there are some days where it's like, I really need you to use the steps. And
Yeah.
today, can we just use the steps
Yeah.
today?
Yeah.
Because
Yeah.
can
Yeah.
you stop?
I know. I know.
And so one of the things that I like about this field is it seems like there's a lot of tools in the toolbox and,
Mhm.
you've touched on things, like the laser and,
Mhm.
there's home versions, there's
Mhm.
office versions. Like, can you tell us some of the different tools that you work
Yeah.
with?
Yeah, so I love, I have one. I'm just gonna reach for it, because I have it with me all the time. One of the lasers that I work with, and it's a similar one that we use in the office, and it's one that we rent out or sell to owners to use at home. And it's funny because so many owners wind up using it on themselves, and they're like, we're just gonna buy it for the dog." I'm like, "Yeah, whatever." That's fine. But the laser helps, certainly reduce pain and inflammation, but there's also a lot of factors with, we want to look at improving the growth factors. So, like when we look at that arthritic knee, we don't have the proper amount of synovial fluid flow because we're not getting that appropriate compression distraction. So we start to get some of that action in there. We start to get some of the stem cell effect in there, and we get the healing, the anti-inflammatory, basically making, I always say, it lets the body heal itself. Then there are different settings to help with muscle repair. So we know from the human side, athletes use it to build muscle. So we can use it on the dog's quadriceps, their hamstrings, to help build that up. And that's, if owners are a distance from me or can only come in maybe once a week, that's something I definitely have them do for anywhere from 2 weeks to 2 months, depending upon how bad. We also do shockwave, which shockwave is a different type of modality, and it sounds worse. Like just the
Yeah.
term shockwave is like, "Meh." Like I'll say it to owners, and they're like, "You're going to shock my dog?" I'm like, "No, no, no."
No.
I'm like, even cats get it and they're fine. Um, and this helps with some tissue regeneration and bone regeneration. So it's very effective with arthritic cases, with soft tissue cases. It's, as I said, does not hurt the dog. There are a couple types of shockwave. We use something called piezoelectric. Um, there's also pulse electromagnetic field therapy, which may be used as well.
That's the PEMF.
Yep, the PEMF, and there's different types of, PEMF, and you can use them in conjunction. So a lot of times we'll shockwave while the dog's lying on a PEMF bed, and then, like, lots of, hands-on. So many times the dogs, even though they're coming in for their, let's say, left cruciate, there's a very high chance that their right cruciate has already been injured. So we're treating that. And then the compensatory. So, like, if we're limping on our leg, our back may be sore. So we're stretching, we're treating, mobilizing, and then we get into, like, where dogs think they're just playing. So the therapeutic exercise, land treadmill, underwater treadmill, all that sort of stuff. And then factoring in diet, appropriate supplements. Talking about diet is such a, like, difficult conversation to have, especially when they come in with, like, I'm like looking, these are from my horse, but come in with like Swedish fish, and they're like, "Yeah, these are the treats for the dog." I'm like, "No, they're not eating this." Uh, and just kind of discussing, like, "All right, we have to get through this," kind of things. So, And then like talking about home program and what they do at home is way more important than what we do, because we can have this great session and do all of this healing, but they can go home and throw a ball or let their dog run in the backyard chasing squirrels, and they're going to undo everything we just did. So,
So it's a big part. The pet parent plays a really big role, right? It's not just show up
absolutely.
once a week
Yeah.
and yeah.
And it has to be like, the husband has to be in on it. Like, it can't be like the husband keeps feeding him snacks or, I'm like, no, no, no. This has to be like a team effort. Like, you're spending money, like, so this has to be everybody's on board here kind of thing.
I feel like that's probably the hardest part of your job.
It's like sometimes I literally like come in and my office manager's like, what now? I'm like, wow. You know? I'm like, I love the dogs I work with. I'm like, "Ugh,"
But
trying
yeah,
to get through. I'm like, I need a therapist on staff for me, you know?
like, you're probably not wrong that it would take a therapist to intervene in
Yeah,
some
it's
of
like
these
all these family, like, okay, like it's not my
dynamics and
problem. Yeah,
yeah.
that your husband overfeeds your dog. I'm like, just make it stop. You
I can appreciate
know?
the struggle there.
Ugh.
Oh my gosh. And so, we've talked a lot on our podcast about red light therapy, but that's different
Mhm.
from the type of laser you're talking about, right?
Yeah. So, laser is an acronym for light. Let me see. My Usually my brain starts to shut off at like 4 p.m. Eastern. Um, Light amplification, the stimulation, emission of radiation. So, like when like this laser has a light emitting diode in it also. So when we're talking about like I'll see if I can make it just go for a second. So you're getting some red light as well, in it. Usually when you see like the red, you'll get the red light in it. It's more of a superficial treatment, meaning more it penetrates about 1 millimeter. The laser can, depending upon the wavelength and the frequencies, able to go deeper. So that's like when you see the different prices of lasers on, let's say, Amazon or even like different professional models, and you'll look at the different classes, the different wavelengths, the different powers, whether it's just a red light, LED, or a real laser. That's when you start getting into the depth of penetration, what it's going to do, and all of that.
'Cause I've seen the ones where, like, people or they'll even put, like, goggles on the dog or
Mhm.
the, like,
Yeah.
practitioner has, like, the
Yeah.
goggles on.
And that will be, so that the eye safety is, you'll need it for a class 3B or a class 4. And so owners should not be able to purchase a class 3B or 4, but I think on eBay you can probably buy anything. So and you could do damage to your eyes with that. So our clinic, we have a couple of them, and we do require eye safety. Like this is a class 1, so it doesn't need eye protection. You can't. We actually are doing a study on dry eye in dogs where you laser the eye to treat
Oh.
dry eye, which is pretty cool. So
Oh, okay, that's
yeah,
interesting.
like the overpopulation of Frenchies that all have dry eye, I'm like, "Wow." I'm like, "I have a ton of those coming to the clinic." I'm like, "Incidentally, let's just treat them, and make this go away." So, pretty cool.
Yeah, so are Frenchies a big part of your practice? I feel like there's really been a real boom in them, at least in my area lately.
They've overtaken the dachshund for back issues.
Wow,
Um,
that's saying something.
yeah, and most of them are definitely fat. They're just poorly bred, at least the ones that we're seeing. They're wrong colors, they're just skin issues, they're just a mess. So, breathing issues, like, yeah, like, you can hear them like a mile away
Yeah,
with
they
their
have that
Yeah.
that
yeah,
real flat face.
brachiocephalic.
Yeah.
Yeah.
Yeah, I was gonna ask if there are certain breeds of dogs that you're prone to
Yeah.
seeing because I was thinking dachshunds.
Yeah, that fortunately has been like they've been down on the list and just like popularity, we see a lot of Labradors,
Yeah.
of course, a lot of golden retrievers less with cruciate disease, more with, again, they're just more popular. A lot of little Morky Poos, those little, things with like patella issues and stuff like that. Um, yeah, and a lot of like mixed breeds. For some reason, like the floodgates have opened with greyhounds lately, and I don't know why. I just think it's coincidental, but Frenchies, yeah, definitely. They're like a dime a dozen right now. There's so many of them.
Yeah, I'm always interested, because I've always had pit bulls, and it's like
Mhm.
they're very prone to CCL tears, it
Mhm.
seems, and,
Definitely.
I'm always interested in, like, what
Yeah.
different breeds are more prone to.
Yeah. I know. We have a Dalmatian coming in. I'm like, wow, we haven't seen one of those in like 10 years, like, where did that come from? Yeah.
And so
Yeah.
what should us pet parents be doing at home to help our dogs, hopefully so that we don't have to go see
Yes.
you?
Yes. So I would say definitely. I probably like already just hopefully drove this home. Like, keep your dog at a good weight. Like, I can't, studies have shown that your dog will live longer if they're at a good weight. Like, some studies have shown 2.2 years longer, so that's significant. That's like huge. And, it's easy to let the weight creep up. I mean, I've definitely done it with my own dog, and it's hard to get the weight off. And I feed a raw diet. I do have a husband that feeds them Italian food and, all of that. So I get that. Like, when I travel, I cut back on their food for weeks ahead of time. So I understand that. But really trying to focus on a good, healthy diet, so that makes such a big difference. Like, I could probably, when a dog comes in, before I even ask like what they're eating, just I could tell from their coat, from their smell, like everything. Like, if they're on a processed bad food compared to a good, food. Keep them moving. So, like a dog that's mentally and physically enriched, that does so much, to their limit. I mean, you don't want to be out hiking with a Frenchie in 100-degree weather,
Yeah.
but, there are other things that you can do. They're simple. You can do activities inside, like simple balance activities, simple things. They're meant to be active creatures and not couch potatoes. So, and pay attention to them. I mean, as simple as that sounds, like we talked about, just keep that journal. You know, the quicker you notice something different, the easier it'll be to nip something in the bud. Like, I always have hands on my dogs, and I'm sure everyone does. But if you notice something or something feels different, get it checked out.
And so I've seen that there's been more, you're in a growing field. There's more certifications
Hmm.
coming out and stuff. So if people do want to work with somebody who's certified in
Yeah.
a canine rehab or adjacent
Yeah.
field, like what are some of the qualifications they should look for?
Yeah, so definitely look for someone that has education. And there are a variety of programs out there right now, and they'll indicate that they're a certified rehab professional. And there's, just to list a few, there's a CCAT, a CCRP, a CCRA. And again, like off the top of my head, just listing a few of them. So someone that has knowledge in the area, and I always say that's been doing it for a while, and everyone has to learn, but if they're learning, at least have someone else that has more experience, or, also ask in the community, like who has worked with who, and just especially if you have a particular breed, or maybe you have an aggressive dog that needs a little bit more hand holding, definitely ask around, because it's going to require a little bit more attention, than, just the average person. Not everybody wants to work with an aggressive shepherd that wants to rip your head off. So, understanding like why, what, all of that. And it's okay to, ask the questions. Like I always tell the pet owners, I tell people like, you know, be an advocate for your animal, ask the questions. If you don't feel comfortable with a particular person, go to someone else or, get another opinion. And I have 7 people on my staff, and they're people I don't click with or dogs I don't click with, and they click with someone else. I'm like, "Perfect, go spend time with them," so work's easier.
Yeah.
And so do you see a lot of, like, athletic dogs, dog sport dogs, the working dogs? Is that something you see a lot too?
Yes. Yeah,
Mm.
we do. We see a lot of them. In the state of Connecticut, we see a lot of the working police dogs, and a lot of that is prevention, but they know that any of the police dogs get injured. Which is usually frightening. I get a list of text messages at like midnight,
Mhm.
like, so and so's hurt, so and so, like, we don't, we want you to see him first. And I'm like, oh boy. Um, but yeah, and a lot of the agility dogs and working, Schutzhund, all that sort of dog stuff, and the show dogs, and like I love. It's always fun, different challenges.
Yeah.
So on different levels.
Oh my gosh. I kinda feel like I should have your job. Like, I wanna do that,
It's you know what? Every day is like no day is like, the same. There's always something like on last Friday, we had a duck in the back room and we had a couple labs. And of course, the duck's quacking and the labs are like, I need to kill that, And, and my office manager is like forgetting and leaving. We have a series of doors, leaving one door open. I'm like, what is wrong with you? Like, these dogs can kill that duck. I'm like, this would be so bad, you know?
Was the duck also one of your patients?
Yes, yes.
Oh,
And and she's like just not clicking. I'm like, and it's Friday, and I'm like, I'm gonna kill you. Like, just, yes. So there's
wow.
always like a variety of like, things, the different dog personalities and then people personalities. And yeah. So
Yeah.
And so I'm
Always.
just thinking dogs, but what other species do you see?
so we've seen we started seeing some ducks that were injured, and that kind of led to more of little creatures. Like we saw a turkey. These people, Bonnie, who is so sweet. The owners were rescuing meat birds, and so Bonnie was with Clyde, and because she was bred to be so big, her little legs were so arthritic. So Bonnie came in and she rode in the front seat with her owner, and we I didn't realize how sharp or big their beak was until I was down on the floor with her. I'm like, things could go really wrong here. But she was very sweet, and she actually rented a laser. They treated her at home, and she was all good. We had an alpaca in. We've
Oh,
had little guinea pigs, goats, all that sort of stuff.
wow.
Yeah, turtles. Yeah, so cats. The majority is dogs, but yeah,
Oh,
I'm
wow.
like it's all
That's
good.
so cool.
All living, we can do it.
Oh my gosh. Well, thank you so much for your
Oh,
time
you're so
today.
welcome. Thank you.